I am Bernardo Cortese, an interventional cardiologist from Milano, Italy. My affiliation is Fondazione Ricerca e Innovazione Cardiovascolare from Milano, a foundation which is devoted to clinical research in the cardiovascular arena. Today, we are going to discuss about the late-breaking trial clinical result of the EASTBOURNE Registry, primary endpoint assessment. The background of EASTBOURNE Registry is the drug-coated balloon. The novelty in this area is the sirolimus. Sirolimus is a new drug that came out in 2016. So from the very beginning of this new technology, by means of Magic Touch DCB, we decided to do this prospective registry because we needed to have some good, reliable clinical data with this new device. The design of the EASTBOURNE study is a prospective registry with central adjudication of all the events, a multi-center study from all around the world. We have enrolled 2,123 patients, rendering this the largest study ever done on DCB. The device used in the EASTBOURNE registry is a novel drug-coated balloon eluting sirolimus. A Magic Touch is a DCB which has a new technology which with a nanocapsule is able to deliver correctly sirolimus to the vessel wall and to keep it there for at least 1 month. This is the timeline where we want the drug to interrupt the restenotic process. The key findings are very reassuring in terms of safety and efficacy. We have found the primary endpoint of TLR in 6% of the population, with a high variability between instant restenosis patients and de novo lesions. Like for PCB, paclitaxel-coated balloons, instant restenosis has a higher TLR, whereas de novo lesions has a very low TLR of 2%. The other endpoints, like MACE and bleedings, are very low, and we are optimistic on the results of this study. We have observed no safety signals in terms of bleeding. As I was mentioning before, the bleeding rate was very low, even because with the DCB technology you may have a very low duration of dual antiplatelet therapy. And we have had no thrombotic problems, no thrombotic occlusions in our population. The key take-home message for the clinician regarding EASTBOURNE registry is that the Sirolimus-Coated balloon, this type of Sirolimus-Coated balloon is already here, showing a very good safety and efficacy profile. So we may want to use these in a real-world population like the one that has been enrolled in EASTBOURNE. This is a real-world population with a lot of calcific lesions, very long lesions, so we can be safe to use this device in this setting. The next steps are already here because we are running 2 randomized clinical trials. Transform 1 is evaluating this device versus paclitaxel-coated balloon, and Transform 2 study is another randomized clinical trial, international, which is comparing Magic Touch versus Science in native vessel disease. So in the next 2 years we will have more data on this device.